All right. So we will just go ahead and start the recording. Let's not forget that. Okay. So once again, a very, very warm welcome to everybody. Thank you for joining us today. I'm so happy to see a lot of known names and faces, and of course some new ones. So all of you all, welcome, welcome, welcome. Let's start this. All right, and okay. Okay. So I wanted to take you through, before I take you through what's in store for today, and before I welcome Dr. Kamlesh officially, I just wanted to quickly take a moment to let you know on what's coming up at Homeopathy Musings. So we're going to have Dr. Sunita Gandhi very soon on the 7th of October, Saturday. And she's going to do a lot of therapeutics about fevers and how to handle them. A lot of you in India are already dealing with a lot of viral cases, lots of dengue, malaria, etc. these days. So I think this is going to be one very good lecture to look out for. So do join us. It's going to be in the afternoon in India. We have Dr. Ajit Kulkarni, who's going to take up defense mechanism. Some of you already know about it. A lot of people have registered. If you've still not registered for this, I highly recommend this. It's a 6-day workshop where Dr. Ajit is going to share his novel concept on defense mechanism and how it's going to be very helpful for us as homeopaths. So welcome for you to join. After all these virtual meetings and webinars, we thought it was time to meet in person, meet in nature. We're going to be studying monocotyledons, but not just study homeopathy, but also do a lot of therapy, meditation, yoga, a lot of healing items from 30th November to 3rd December. Initially, this program was only for our plant module participants. As you might know, we had this 1-year program ongoing this whole year. It's coming to its finale. So initially, we thought it's going to be only for the participants of this module, but we decided why not extend it to the entire Musings family. So if you would like to join us, please look up for the details for it. And finally, what I am most excited about to share with you is this group of friends, colleagues, peers coming together. Dr. Kamlesh, Dr. Charuvahan, Prajakta, and myself to bring this idea of empowering our students, our interns, and homeopaths who are early in their practice. You know, how can we simplify homeopathy for them? How can we equip them with good quality clinical tools so that they can be successful homeopaths? So from classroom to clinic is going to be coming up very soon next year. And as part of that series, we're going to be in a way inaugurating this series with Dr. Kamlesh. He is we became friends over the last 1 year. All 4 of us were part of this Gurukul program, which I'm sure you all know about, which Dr. Sankaran, of course, led. We were all his apprentices, and you know, he led us, taught us, inspired us for 1 year. We were a very small group of handpicked homeopaths. So I made friends with Dr. Kamlesh there. I got to know him personally, and I got to see his practice and amazing work and results that he's been getting. He practices out of Nagpur, a very, very humble homeopath. He's also, you know, kind of, he heads the tertiary center of sorts of the Other Song Academy. He's a mentor at the Other Song Academy, and he's also the secretary of the AAS Health Foundation. Today, he's going to be talking about, he's going to be sharing 3 cases about severe pathological cases and how can we treat them with homeopathy, but also the simplicity of dealing with some so-called difficult or challenging pathological diseases. You know, you will hear the name and you will be like a little overwhelmed, but how can we stick to our basics? How can we, you know, strengthen our foundation? And how can we use some of the contemporary concepts to deal and manage these difficult cases? So he's going to be talking about that. And in a very, very short while, I promise I will not take more time between me, you know, between you all and Dr. Kamlesh, but some basic hygiene factors, some reminders. Please keep your lines muted. If you like, keep your videos on. You know, if you keep your videos on, you can interact, he can see you, he can understand whether you're following, you're not following. And of course, it avoids the temptation of multitasking, yeah? Please reserve your questions for the very end. You can type your questions on the chat and Kamlesh will take those at the very end of the session. Sometimes we scribble on the screen when we are multitasking. Don't scribble, it's very, very distracting to the speakers. So please be a little mindful about that. The presentation will not be shared per se, but you can make notes, you can take screenshot and enjoy. I think share your experiences, enjoy. That's going to be the most essential part. We are going to, the Zoom room is going to be full at 100. We are very, very close to that. If you have friends or colleagues who would like to attend live, we are going to be going live on YouTube. You see the link there. You can go to YouTube, you can search for Healing Harmony Homeopathy, and you will see this session live there. People attending on YouTube can also ask their questions or put their comments in YouTube, and we will make sure that Dr. Kamlesh sees that and he's able to answer that. Okay, so in case you have any technical difficulties or anything, you can write to us at homeopathymusings gmail.com, and you have the numbers of Asmita and Dr. Krutika who can help you with anything that you need. And with that, Kamlesh, can I invite you to take it from here? We're really looking forward to hear from you.
Okay, thank you, Dr. Priti. And I am so glad to see all of you at this beautiful evening here in India. I learned that a lot of participants are students or beginners in their practice. But now I can see that there are a lot of experienced homeopaths too. So let us
Kamlesh,
start with
I'm very, very sorry to
yeah.
interrupt. I didn't mean to. Just so that if you're finding it difficult to understand English or accent, we have the captions switched on, so you can look at the transcript if you like. Sorry, go ahead, Kamlesh.
Yeah, sure. So let me share my screen. Okay. So basically, we designed this webinar for students and beginner practitioners. So let me really go very quickly for basics of homeopathy. Mm, let me talk first something very important and very basic. First, homeopathy is based on holism, concept of holism and individualization. Holism means we consider patient as a whole. We do not consider patient in parts, like his this organ is different, this system is different, mind is different, body is different, but we consider patient as a whole, complete, and we consider that this whole patient disturbs in a very peculiar way, and this is called as individualization. We all know these facts, but sometimes we miss implementing these facts in our practice. Believe me, I deal with lot of pathological cases and different type of cases, but in each case, I come to know, reconfirm that my medicine, my prescription is based on these two principles, these two basic. I never prescribed on single part or single. Without this basic principle, we cannot prescribe in any type of case. Maybe it severe pathological case. And that is what I want to demonstrate in today's webinar. Whether maybe it very gross pathological case, but you need to see individualization. You need to see that person as a whole. You cannot just consider pathology and just prescribe. And you will see the results. And While doing this, we all have lot of problems. We have to face many questions. We have to come across many difficulties in our practice. And answer to all these questions are already given by Dr. Henneman or our stalwarts in Organon of Medicine, Matura Medica, and Repertory. So I recommend new students and new practitioners to really get well versed with all these three basic factors, components of homeopathy. You must be very well versed with organon, each aphorism, materia medica, and repertory. You must know everything. This is mandatory to start practice and to do good practice. So these keys, these answers are like keys which are scattered all over, and we need to choose, we need to pick a right key for the right question. And that is art, and that is to be learned. So we have two parts. We have answers and we have skill to apply these answers. So both of these two things should be learned very carefully and dedicatedly. And practicing homeopathy is very easy. Believe me, it is very easy when we follow very strictly, very religiously these basic principles, these basic literature and fundamentals of homeopathy. If we are very grounded, if we are very good at these parts, then we can practice very easily and we can produce good results too. So let us start with our topic. Now, today's topic is simplicity in handling pathological cases. How I define pathological cases in my practice, those cases which has very limited scope in modern medicine or other traditional treatment. We cannot do anything in those type of therapeutic methods. And we have very less information available. Generally, we took case for 2 hours, 3 hours, but in such type of cases, we cannot give much time because there is very limited information available. Probably sometimes patient is in coma and we don't have any information, source of information. So let us see with cases how to do this. And also, these are those cases where we need very fast result, instant result, because we cannot afford to waste our time and patient's time because patient's life is at stake. So we need really quick results. And what Dr. Hahnemann has told in aphorism 2, the highest ideal of cure is rapid, and this should be in shortest way. So we expect, patient expect, his relatives expect very rapid result in very short time in such type of cases. And to do this, we must be perfect in understanding the patient, not only the disease, not only the pathology, but the patient. So to understand the patient as a whole is very important. We must be very perfect in analysis. Our analysis must be very accurate, and this will give us confidence in prescribing. So let me demonstrate this with cases. So first case is of a 47-year farmer who was suffering from ADHF, acute decompensated heart failure. So heart is already lose its compensation. Body is not compensating on its diseases. So it is decompensated heart failure. Coronary artery disease, acute coronary syndrome. And this case is of post-angioplasty. This angioplasty was already been done to left anterior descending artery. And there was severe left ventricular dysfunction. And this patient was suffering with bilateral pleural effusion associated with subpleural vessel atelectasis. Let me tell atelectasis for students and one who don't know. So it is collection of fluid in pleura and which compresses lung, part of lung or whole lung, and because of that, alveoli gets collapsed. Patient cannot breathe freely, and he has recurrent bouts of cough and breathlessness. And this condition is already decompensated. Probably you can understand the severity of the patient. This is a 47-year farmer, means he belongs to very poor family, poor hygienic conditions, who is not literate at all, doing hard work, physical hard work, and this patient suffered with such a grave pathology. And when patient visited me, he had some set of symptoms. Let us see. So patient has to hospitalized frequently every 3 and 4 days for this pleural effusion. So there was recurrent pleural effusion happened 3 to 4 days at the interval of 3 to 4 days. And because of that, he had cough, breathlessness, and fever. Every time he has this pleural effusion. And all higher antibiotics were given to the patients, but they were not working. And he has this recurrent pleural effusions. And every time he has to drain that effusion through injections. And now, doctor fed up doing that recurrent, doctors advised him to insert permanent cannula in his back for drainage of this effusion. Because higher antibiotics were not working and there was need of recurrent pleural effusion to drain. He was asked to hospitalize next day, next morning for that little surgery. But our patient was not very willing for that surgery. He was frustrated and disturbed by his deteriorating health condition. And at that point of time, relatives want to see if homeopathy can do anything in this condition. I hope you can understand the severity of health condition of that patient, where all his organs are failing to respond. Traditional method is not working, and now they are coming to us to see whether homeopathy can do anything for them or not. And our patient was so frightened that he don't want to go out of his house. He even didn't came to see me. Though he was physically active and can walk by his own, but he was so frightened. And relatives requested to see him at home. And then I visited patient at his home and I observed some of the symptoms. He was having chest pain while changing sides in sleep. And this chest pain was more lying on sides. It was less on lying straight on the back. This chest pain was more after pressure. And he has to sit up in sleeping position. Also, he has distension of abdomen with ineffectual urge for defecation. He has sleeplessness with heaviness of head. He could not sleep at night. And cough was associated with nausea and heat in chest. He could not eat, only having fruits. He don't want to have any other food. No lunch, no dinner, only fruits he want to have. And he has that itching of hands at intravenous site, especially. What I observe is his all symptoms were changing. When I asked him about his pain, he was saying sometimes it pains here, sometimes it pains here, sometimes it pains here, sometimes I have this complaint, sometimes I have that complaint. And also, he was having body ache. I interrogate him, tell more about his body ache. And he said that he don't know which part is actually paining, but he has body ache. He could not pinpoint at the specific point because he was having changeable symptoms. He was profoundly weak and having no energy. Patient was chilly and all of his pains were more at night. Whole day he sits quietly or people are around him, but at night when he could not sleep, then all of his pains were more. He was restless and weak, especially at night. Patient told that he feels his pulse very fast. It is beating like duck, 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 duck. And his wife told that he talk a lot at night. He could not sleep and he talk a lot about at night. I asked her what he talk about. And she said that he talk about past incidences, what happened in his life. He was irritable and he felt that wall is falling on him from back and he was having irrelevant talk. He feels that his head is big and large and specifically during pain, he pulls his hair. Whole day, he stares in blank and not want to talk to anyone or go out of house. He frequently tell his wife that someone took money from his pocket. So he repeatedly used to tell that check in my pocket. Someone has taken money from my pocket. He's sleepy, but he could not sleep because of restlessness. What I observed is he was constantly moaning while sitting, while talking. He was constantly moaning. And he was startled and frightened during sleep. So this is the case. Now, what we can do in such type of case, where we don't have much time, pathology is severe, pathology is increasing day by day, he needs to get hospitalized and apply permanent cannula, and patient is not willing, patient is emotionally frightened. What we can promise to the patient and relatives, what homeopathy can do, what may be the prognosis, and what to do in such type of cases. So let me tell you follow-up of this case first, and then we will move to analysis of the case. So after prescribing medicine, on third day, patient reported, he himself came to clinic and he reported that his restlessness is decreased. He has itching on the skin. It is more now. Cough is markedly decreased. He has pain rectum after stool and especially during coughing. And we prescribe SL because he started to improve. His restlessness was very less. On fourth day, that itching was almost gone. Pain rectum decreased much, and there was pricking pain left hypochondria. So symptoms you can observe in follow-up also symptoms were changing. Sometimes he has pain in rectum, sometimes he has pain in left hypochondrium. But his main concern, main problem was decreased. On sixth day, he had pain abdomen that was almost gone. He had pain right side of neck and right side of back. Chest pain was almost absent, no restlessness, no breathlessness, no cough, only slight weakness, and appetite improved. And he started to have regular meals. And he kept on improving after that, and no need for hospitalization even once after that. He didn't apply that cannula, and no need for uh, draining that pleural effusion after of medicine. Not a single time, not for a single time. And he was perfectly okay and resumed his work after 4 months. He's farmer, so he resumed his work, means physical exertion. He can do now. Even cardiologists and pulmonologists were amazed of his dramatic improvement. How can he, such a deteriorating patient, can improve so quickly? So now, question for us is how to do this, how to produce such predictable results even in such bad pathological cases, and that is also consistently. So for me, when any case comes, then two things are very important: understanding of case with classic ways, basic tools of homeopathy, and with contemporary tools, newer ways. So first, let us try to understand how to understand this case in a very classic basic tools or ways. So what is our case? Our patient is frightened, our patient is anxious, and this anxiety is more at night. He was continuously moaning and groaning from pain. He's startled from sleep. He wants to pull his hair. He's suspicious, mistrustful that someone is taking my money. And there is constant changing of symptoms. So I consider the same rubrics, and you can see in repertorization, aconite is coming very prominently. And what Materia Medica says, in Fatak Materia Medica, it is written that there is great anxiety, agonizing fear, and restlessness accompany every ailment, however trivial. Fear of death, fear of crowds, patient is not going out, crossing the streets of future, of touching others passing by, very impatient, beside himself, frantic from intensity of pain, with fear, screams and moans, gnaws with feet, bite the nails, want to die, afraid to go out of the house, foreboding, spreading the time of death, terror-stricken. Music makes him sad, clairvoyance, feel as if what had just been done were a dream. Delirium, fitful mood, laughing, singing, then sad and fearful, anxious, excited, nervous, feverish, imagine some part of the body is deformed. So this is what Dr. Fatak say. And we prescribed him aconite 200 with followed by aconite LM6. And you can see the results. So what we did in this case, we tried to understand the patient, not just his pathology. Yes, aconite is very good medicine for heart conditions, but we did not prescribe just from that. We tried to understand the patient as a whole. And then we tried to match everything. And aconite worked very well. Now, let us move to another case. This is a case of 54-year male patient suffering from cirrhosis of liver. And that was caused by chronic alcoholism. He was known case of hypertension and hepatic encephalopathy. He has ascites since 8 months and was on already was on allopathic treatment, yet his condition was deteriorating. And he went into coma since 2 days. And relatives rushed him to the hospital. They bring him to many private hospitals. They denied to hospitalize him. And finally, they rushed to the government hospital. And doctors from government hospital denied to actually get him admit. They told relative that you can take away this patient to your home because anyways he is going to die within couple of days. His condition is so bad that he is going to die within two couple of days. But at it was late night, so relatives convinced those doctors to hospitalize him, and finally, then not so much with willingness, they admitted him. And then next morning or afternoon, relatives came to me and they were searching for any scope in homeopathy for his patient. So again, now what we can do in such type of case where patient is already very hopeless, he's going to die. Even allopathy doctors is not going to hospitalize him. What we can do? What we can promise the relatives? What may be the prognosis? And what to do in such case? So patient was already in coma and we don't have to take case. We don't have subject to take case. Then how to collect information? As I have mentioned earlier, all the answers are given there in our basic literature. Organon, aphorism 84, where Dr. Hahnemann has told that patient details the history of his suffering. So patient himself is first source of information. Those about him tell what they heard him complain of, how he has behaved. This is second source of information. Our patient is in coma, so he is not going to tell us information. So what is second source of information? Is his relatives, those around him. They will tell what were the complaints of patient or how he has behaved or what they have noticed in him. This was second. And third was physician. What physician sees, hears, and remarks. What we did in first case, we observe a lot of things. That patient is moaning and all. This is third source of information. So definitely we ask relatives, what was the problem? What was the history of this patient? So they told me that since 8 days, patient started to remain silent. He was not talking to anyone. He used to sit quietly with head down, just sitting quietly, head down and talking to no one. Sit quietly at corner of bed with head in support to wall. He answers only in one word, and when asked any question repeatedly, then he gets angry. And strangely, he went out of house few times without telling anyone. He has never done this before. But since few days, he just went out of house and someone found him, some relatives found him, and then they bring him back to the house. And on previous night, his eyes were wide open all the night. And next morning, he was semi-conscious. He was having all these complaints 6, 8 months, all complaints of liver cirrhosis. And he used to say that I will not get cured from this disease. But I want to go to doctors and I want to take medicines very promptly. And whatever relatives used to tell, he was he get very easily convinced. He used to agree whatever justification is given. he realized that he has done some mistakes. Mistakes mean he consumed a lot of alcohol. And because of that, he fell ill. He has this cirrhosis of liver now. And now he has to take strict action to come out of it. That's why he was so willing to go to doctors and follow their instruction very, very strictly. I hope you can now portray his mental state. He craves for non-vegetarian food, especially meat and milk, and his tools were normal. So I have not seen this patient for a single time, even after prescription. So patient patient's relative used to record video from hospital and they used to send me. So this is the first video they sent me. Probably you can observe that patient is unconscious and not doing any movement, not responding to anything. And at this stage, we prescribed him medicine after considering all the informations told by his relatives. And I asked relatives to inform me every 2, 3 hours, any change, any slightest change. They have to inform me. And what relatives observed that after 3 hours of medicine, he started gaining consciousness and he started moving his limbs. And by next morning, he was well oriented to his surrounding. After 3 days, he discharged from the hospital and he directly came to clinic to visit me. Within couple of months, he was free of all the jaundice symptoms and he was perfectly all right. Let us see his next video. After 3 hours of medicine, you can see he is moving his limbs. He is moving his hand. He is moving his legs also. And he started whipping when some of his relative told him something. And this is video of next morning. Patient is completely conscious, aware, and answering properly. He's talking to his son. We need to put that box to maintain privacy of patient, but you can observe a lot of movements and lip movement of patient. So what is the analysis? You can also put your thoughts about case in chat box. So what is our patient? Very remarkable symptom for me that he want to leave his home. He was taciturn and he don't want to talk. He don't want to answer. He just want to sit at one place. And when forced to answer, he was angry. He kept his eyes open during sleep and he was frustrated about his recovery. These are for milk and meat. And anxiety conscience of as if guilty of a crime. This is complete rubric. Anxiety conscience of as if guilty of crime, as per old Kane repertory. So he feels that he has committed crime. He is guilty. And that's why he has to face this. And now you can see Briannia is coming very prominently. We all know that Briannia is very good liver medicine. Also, but what we have considered is totality as a whole. And we asked relatives to apply 10M potency, Briannia in 10M potency locally. Because this is my experience that if patient is in coma, then apply that medicine locally on his palm or soles, and patient respond very well. We have third case, but I think we will be out of time. So let me skip this third case.
I think, Kamlesh, we can
But
continue.
idea is same. Idea is same in all the cases. And this
Sorry,
is my
Kamlesh.
message to all that we need to consider patient as a whole and we need to find out his individualistic symptom. This is the idea. Whatever may be the pathology, forget about pathology. Pathology is important, but what is more important for us is patient, that person. That person is very important because pathology is growing on that person. Pathology is not everything. What we treat in homeopathy, we treat man in disease, not the disease in man. This is the basic, this is the message of this webinar, my friends. We all always look for that person and everything will match. That pathology will also match with your medicine. So now, till now, we have seen how to look for basic things, basic approaches in case. Now, at this point, I want to tell you about something different, something new approaches. So, it is a concept of superclass. All the personalities can be divided into 6 nature types. Nature of individual can be divided into these 6 types. Any person we can classify in one of these 6 types. And this is very convenient to use this superclass feature. It will be very easy to prescribe because if you see any patient and you want to search for the medicine, homeopathy is full sea of medicines now. Now we have more than 10,000 medicines. So how to reach to the particular one single medicine? It looks very difficult. But what if we classify all the medicine? So as we have classified 6 basic types of people, we have classified all our materia medica into 6 different superclasses. So each superclass has some plant medicines, some mineral medicines, and some animal medicines. And if we could reach to one particular superclass, our choice of medicine becomes very restricted, and it will be very easy to find medicine in smaller group. So I want to discuss you about this. This is very simple, but very important, very practical, and very easy to practice in your practice. So first group is one who withdraws themselves. If there is any problem, they tend to withdraw themselves like into the shell, because problem is too big for them. They cannot face that problem. So they withdraw inside. This is the first type, withdrawal type. Second, for second, withdrawal being inside is too boring, and they will pop outside. They will see out. They will see that outside is frightening, and again they will come inside. So they will be inside, they will come out, again they will come inside. So in and out is second group, second superclass. Third superclass. Third superclass, people who will be in a boundary, in a limited space. They will feel, they will perceive life as when, if they will be in that boundary, they will be safe. Going out of boundary is scary. This is third group. Fourth superclass, they want everything stable. They want everything as it is. They want their health to be as it is. They want their finances to be as it is. They want their job to be as it is. They don't want any change. Fifth superclass is more courageous. They will try and go outside. They want to explore more. They want to see new opportunities. They want to move out. If any problem, they want to move out. And for sixth superclass, problem is like a fight. They either fight or flight. So this is sixth superclass. So let us now try to understand our two cases with perspective of superclasses. So what was our first case? He was so frightened, he was so scared, he was so panicked that he withdraws. He don't want to go out. He don't want to talk to anyone. He don't want to meet anyone. This is first superclass. Going inside, being inside, so sensitive, so touchy. And in first superclass, he's plant because he's so sensitive. And in my knowledge of first superclass plants, he belongs to Ranunculus family. Ranunculus family belongs to first superclass. And aconite is one of the member of Ranunculus family. So this is how we can look after rubrics, we can look after materia medica, we can look after superclass understanding. And everything matches. And that's why we have good results, even in such difficult cases, because we have considered everything. What was the story of our second case, second patient? He don't want to disturb, and home was the theme, going out of home, though it is specific rubric of Briania, but home, security, don't want to be disturbed, don't want change. This is fourth superclass. And as he was sensitive, he was plant, and violence is the family of fourth superclass, which contains Briania and also typhoid misem, if you know. He want help. So when classic and contemporary methods work together, our confidence in prescription increases manifold. This method, this way of prescribing and understanding the cases, this has brought lot of difference in my practice, my understanding of patient, my prescription, and my confidence. So this is what I want to convey to you. If you will synergize both the approaches, your prescription will be better, your results will be better. At this point, I want to share something with you. That Dr. Priti, Dr. Prajakta, Dr. Charuvahan, along with me, has started something. These people are really very good homeopaths, good teachers, successful homeopath, and they have their talent in a unique way. And we together are almost on a mission to promote, to teach, to guide new students and practitioners a bit of homeopathy, good homeopathy with good results, practical results. And in coming days, we will come with lot of activities like webinars, offline seminars, Insta lives, and also this course, very unique course from classroom to clinic, where we will help students to be perfect in their classroom concepts and to go with confidence to their clinics to see patients. And key highlights of this program will be, this program will be of 6-month training program to strengthen your classroom basics, to equip you to challenge in the clinics. We will try to make it very clear and strong your basic foundation like organon, Musings, Matra Medica, repertory, and also help you grow in your clinical practice and will teach you contemporary concepts, newer concepts. This program will be associated with mentoring sessions where you will be personally teach and addressed for your queries. And there will be lot of complementary perks like repertory software. You will be given repertory software and clinic startup kit. So this is going to be very interesting. And to know more about this course and for registration, I will advise you to go homeopathymusing@gmail.com. So this is all from my side. If you have any questions.
Kamlesh, that was excellent. Thank you so much. So what I wanted to ask is, there are a few questions on the chat and maybe I can take them. But before the question, I really wanted to see the third case. But that's okay. I'm sure there are going to be more opportunities. So there's one question regarding for the case of bryonia. How was the bryonia tenem administered, at what intervals and how many days? And also following the acute, was any complementary or anti-miasmatic medicine given post that?
So for first question, Bryonia tenem, I advise to apply on palm and soles every 15 to 20 minutes till we get response from patient. When patient started moving in his limbs, then we probably can increase this interval. But till that time, every 15 or 20 minutes, I advise to apply them on palm and soles. And for second question, when we look at the patient in a holistic and individualistic way, then in my understanding, that medicine itself act as a anti-miasmatic medicine. And we don't need to prescribe any other medicine till symptoms really demand very strongly. So in both these cases, only that single medicine were sufficient and they did their job very well.
Excellent. Any other questions, anybody? Yeah, there's another question. Was Bryoner directly applied or was it mixed in water?
No, I advise to apply directly, dilution. No need to dilute in water.
Okay, perfect. Okay, anything else? And I think there are a few compliments on the chat too, especially on how both the classical and the contemporary methods were integrated. So excellent. I think it was a really, really good session, Kamlesh. Bang on. We really look forward to hearing more about more such cases, more acute pathological cases, and your concepts are so crystal clear. So it's so nice to hear. You make it sound like it's so simple, and I'm sure there's a lot of hard work and training that goes behind this. There's one more question by Dr. Suhanya. She's asking about how does one differentiate superclass 3 and superclass 4?
Yeah, so basically, there is one more question I would like to answer. Before that, this superclass question. So superclass 3 people, they want to remain within boundaries. They don't want to go out of boundaries. And for superclass people, they want everything as it is. So there is difference. It is um, like uh, like a person, like a Indian youngster who don't want to cross their limitations. Huh? So it is very easy, and I think it is very good example of Indian young male or female person who don't want to go out of boundaries of their family ethics. And fourth is adulthood, who wants money, who wants their job, everything as it is. So this is a difference between third and fourth superclass in short, but you need to understand this concept very deeply. And I think we need more training sessions for that. And also I think Dr. Nagarajan has one question. You started the case with classical approach or contemporary approach? So actually, this is not the case that we started with this and we ended with this. There is one case, and our mind, our brain works parallelly for classic approach and contemporary approach. So we should think parallelly, not by this way first and then. This is not the case. And as Dr. Priti has said, it needs lot of strict training. You know how much beating we have faced from Dr. Sankaran. So we need strict training. Yeah.
Absolutely. So there are a lot of books available, and I think Dr. Santosh Kumar is also asking another question on what is a clear map if somebody is planning to follow Dr. Rajan's method. I think, if he were to also say this, he is going to say that first we all need to strengthen our foundation, our basics. That's the first step. And from there are several, resources available. His books are there. lots of his lectures are there. A lot of courses by TOS is there. But the classroom from clinic, from classroom to clinic that we are coming up with next year is going to be exactly that. We're going to take you from the very foundations, from all the basic things that we must master, and we are going to slowly bring you up to sensation and then superclass, etc., etc. So I think if you all are new to the method, if you are young students and would like to learn, that's something that you should really watch out for. There's also a lot of material available on our YouTube channel of Homeopathy Musings. You have the link. So look at all the free material that's available, and you can start kind of working your way through it. All right. Any last thoughts then, Kamlesh, before we wrap it up for the day?
Yeah, it was very nice to express. It's very nice to talk to a lot of people, and they are such a nice audience. And I think they have a lot of questions too. But we will meet in future frequently, and we will probably can afford to answer everything they have.
Perfect. With that, we will call it a day. Thank you, everybody. The recording of this is going to stay on the YouTube channel. And Kamlesh, I'm going to chase you to get to the third case so that everybody can also see that one. Okay?
Yeah, definitely.
Bye-bye. Take care,
Bye,
everybody.
bye, bye,
Bye.
everyone.